99% of Americans don't have idea about what their healthcare expenses are going to be during their lifetime. I'm sure it sounds familiar to a lot of you. When you don't understand the expenses, there are consequences. And there are lots of people who go through the pain of not understanding the expenses. And this picture you see here is one of those Americans. A very successful marketing executive. Everything was going well until one day, through the exam, the doctor told her that she has cancer. Suddenly, everything changed for her. 2 years, she had to quit her job to take care of her health. And it was not easy. It was very expensive. Finally, with the support of friends and family, she was able to recover from her cancer. And that was wonderful. But what didn't stop was all those medical bills. It kept piling up. And it was very humiliating to go through the food stamps, get pretty close to bankruptcy. That was very hard. And Anne is not alone. There are millions of Americans like Anne who go through the same thing. And by the way, it doesn't have to be cancer. A friend of mine was telling this story, 2 kids, one kid lived in Colorado, another in Boston. It just so happened that over a time of 1 week, one kid who fell had to be rushed to the hospital, the same procedures, the tests, the labs. Finally, he recovered. The other kid ran into a car accident in the States. Same procedure. Go to the doctor's emergency room, all that stuff. At the end of the week, the additional cost for him was $10,000. That's very, very hard for lots of people. So what do we learn from all these incidences? That just because you have insurance means nothing. You have to plan for all other expenses. So let's see what's going on in our country. What is government doing? What our system is doing? If you look at all the stakeholders, the hospitals, the doctors, the insurance companies, and the lawyers. Everything is stacked against the consumer. There's nobody who's really worried about what it means for consumer in terms of they taking care of their health and planning for their healthcare expenses. There was a New York Times article which kind of summarized the Affordable Care Act. And by the way, the Affordable Care Act, one thing which it has done very, very well, had educated all of us that healthcare is not affordable. It is very expensive. Not only that, there was another article which said what Affordable Care Act means is you are insured but not covered. Recently, a couple of days back, there was an article in USA Today. Medicare Part B premiums to rise by 52%. I don't know how many people are planning for that kind of raise because they tell us the inflation in this country is not even close to 2%. That's why they can't raise the interest rate. People have, average American has to deal with the consequences of healthcare costs going up, and it's not fun and easy. You probably will all agree that health is real wealth. But is it really? When you have to take care of your health, you have to spend the money. Taking care of health is expensive. It's not like any other kind of wealth, like the home, where you pay the mortgage, but you end up owning the home. all the tuitions for your children's education, where you spend the money on the education, you get a kid who is educated, eventually it makes money. Healthcare, on the other hand, you pay the premium, you pay the out of pocket if you fall sick. It's extremely, extremely expensive. So this is how every average American is thinking when they're growing up. There's a very legitimate question to ask. How expensive is healthcare? Is it just premium? Is it out of pocket, which includes co-insurance, copay, and deductible? And then we were told that when we retire, we will have Medicare. And most of us think it's free. Actually, it's not free. There is Part B premium, there is Part B out of pocket, there's Part D premium, Part B out of pocket. And if you're not done with it, there is supplemental premium and supplemental out of pocket. And don't stop there, because there is long-term care and there's a long-term care. And it also doesn't cover if you were terminally ill and ended up into a place where nobody would pay for it. So healthcare is extremely expensive, and everybody every day struggle trying to understand what their expenses are and how they can save money for it. Trying to understand healthcare expenses is like poor blind people trying to understand the elephant by just touching it. It's not easy. You know, the person who is touching the trunk, he thinks elephant is a big pole. Well, it's not a big pole. It's not a tail. It's not the stomach. It's the same way. It's not just the premium. It's also the out-of-pocket expense, the co-insurance, the co-pay. Not only that, when you are selecting a healthcare plan, you have to understand what kind of plan it is, what kind of benefit it has, what does it cover, what it doesn't cover. How many doctors are going to be in the network, how many doctors are going to be out of the network, because there are implications and consequences of going to a doctor which is not part of the network. Our point is the healthcare is confusing, is expensive, it's very difficult for we, average American or all Americans, to understand our healthcare expenses and plan for it. Now you probably understand that why the healthcare expenses is the leading cause of bankruptcy in America. That's the number one cause of bankruptcy in America, is the unanticipated healthcare expenses. Also cause of huge financial stress in everybody's lives when they run into the hospital or they run into a situation where they have to go to the hospital or incur some expenses. So we're here to tell the missing piece in your financial planning is healthcare. And that is directly tied to our mission, which is we want to make sure every American understand, can plan, and manage their healthcare expenses. So as I was going through this, around 2012, I met Ashwin. We immediately agreed that this is the problem we wanted to solve. His experience in big data, statistical analysis, all those technology was just a right match for two of us to help solve this problem for Americans. Ashwin.
So the problem we know, right? It's healthcare expenses, and we want to solve it. But this problem is at a macro level, right? So what do we do? How do we solve a problem at a macro level? We have to solve this at a consumer level. So we have to first try to break this problem up. So we said this problem has two parts. One is we have to understand what the expenses are. Bipin rightly said that before you can start planning, you have to understand what the expenses are. And the expenses, as you see, are co-pays, co-insurances, and in-network coverage, out-of-network coverage. All of this have an impact on these expenses. And by the way, these expenses are going to be different for different individuals. So based on your age, based on your gender, based on your health profile, based on your healthcare plan, based on where you live, all of these factors actually contribute or have an impact on the healthcare expenses. And the expenses are not going to be the same every year. They have to be different, because when the babies are small, the parents will have some expenses, and probably they will stop as the kid grows older. But as we grow older, we will have more expenses of our own. And these are going to change as the person ages. So we had to understand this. So we had to somehow come up with a way to project healthcare expenses over the lifetime of every individual. And then we had to aggregate it at a family level so that people could understand what their expenses are going to be. And once we have the expenses, then automatically, okay, we just have to come up with a savings plan. So that's all it is, right? So, yeah. Okay, how do we go about solving this problem? We know the problem, we have articulated it, we formulated it. We need to solve this problem. And luckily for us, we are solving this problem in 2015, 14. This would not have been possible in 2000 because we didn't have the technology, or the cost would have been humongous. Only a big company would have been able to afford something of this nature. And luckily for us, Google, Facebook, and all these startups have created this technology where they know more about us than we ourselves know. They know our spending patterns. They know what we are going to buy. If that's the case, can we know what we might be spending on our healthcare? So that's the question we asked. And we said, yes, we should be able to do that. And three technologies came to us, which was a godsend. One was the big data, the ability to process a lot of data. And the second was the ability to do this without owning any infrastructure. So the cloud computing was really a blessing. The third is the data itself. Right now, all of these claim data is electronic. So we have the data available. So we could actually take this data, we could analyze it, and we could compress, we could crunch these numbers and come out with an answer of what the costs are going to be. And once we knew the costs for an individual based on his health profile, based on his gender, based on his family, how many members they have, then we said, okay, now I know how to solve this problem. But that's not the end of the story, right? We still have to make sure that the solution reaches the people, right? So we live in a mobile era, and so we said we have to get this solution to everyone in their hands. So what we need to do is we have to somehow turn this into a mobile app. So we came up with a mobile app, and what it does is it takes the person's information, it takes their healthcare plan information, and it uses our engine in the back end, and then comes back with a set of numbers that tells you what your expenses are going to be over the short run, the medium run, and the long run. And it also tells you what you need to save, how much you need to save. So, ladies and gentlemen, this app is now at the fingertips of every consumer, and we are trying to make it available on iPhone. We already have it on Android, and we'll soon make it available on iPhone.
I think the important thing about this application is making sure that people have technology to understand their expenses. They are able to plan for the specific components. They can plan for their pre-retirement expenses, the post-retirement expenses. They can buy different kind of products. We want to make sure that people have the ability to understand first and then plan for their healthcare expenses. So as we stand here, what's our mission? We believe that our mission will be accomplished when healthcare is really affordable for every American. We want you to get involved. We want you to understand your healthcare expenses. And it's not enough. Have conversation with your family members and friends. So each one of us and our extended family and friends and this country, we all can understand our healthcare expenses and plan for it. Together, we can make it happen. Thank you.